Good afternoon, members of the media. Good afternoon, members of the national community following us on your various platforms at home and abroad, and whether you're on radio, television, streaming, welcome to our regular update on our COVID challenges. And this afternoon, we'd follow the usual format. I ask CMO Dr. Roshan Parasram to take us through the presentation of our health ministry data.
Good afternoon, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. So the COVID-19 update as of 16th of July 2021, the total number of tests done in both public and private facilities, 248,775. Number of new positives over the last 24 hours, 251. Total positive cases since March 12, 2020 to present, 35,679. Those recovered so far, 28,917. Total active cases, 5,780, with a total person in home isolation now standing at 5,123. Those in hospital account for 311. Total deaths at 982. Those in step down, 95. And those in state quarantine, 141 at this time. As at 4 p.m. yesterday, the total persons vaccinated first dose, 234,431, and those with second dose, 151,831. Dr. Hines will go into the FP update, followed by Dr. Richards and Dr. Trotman. Dr. Hines.
Thank you, CMO, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. Good afternoon. I'll go through today's brief epidemiological update with data as at 4 p.m. on July 16th. As we observe the updated epi curve, the epidemic curve, we see that while we're seeing that downward trend from the yellow bars that represented May to the blue ones that represent June to the fuchsia ones that represent July, if we look carefully at the tops of those, we are beginning to see a little bit of a flattening, meaning the angle or the slope, the downward slope has flattened just a bit, which sort of indicates the beginning possibly of some plateauing in that decrease. So we're keeping an eye on that as one of the indicators of the direction in which we're going. If we look at this same data aggregated at a weekly time scale, what we see is that we had been noticing reasonable declines from week 24 to week 25, 25%, from week 25 to week 26, 26%. We noticed that we plateaued between week 26 and week 27. In fact, there was a 1.6% increase, just about. We'd consider that almost the same. And preliminary data coming back from the lab for today would conclude this week about 5% or so above last week. So again, a flattening, signaling the possibility that the downward trend is plateauing, and we need to look at that. We need to observe with caution the trend that we're seeing manifesting itself. Looking at this again at that monthly time scale, we see the overall general decline from one month to the next, from May to June to July. And looking at the age and sex distribution of the cases, we see that it has maintained itself at basically 50-50 over the last 3 weeks or so, male to female proportions, and that 25 to 49-year-old age group still holding the majority, although at this point it's a slim majority. Looking at the age-sex distribution among those fatalities, we see that, as we've been noting, the above 60 hold about 65 or more % of the total deaths. We do have a reasonable number of deaths, a significant number in the under 50 age group, so that we don't want anyone under 60 rather, to think that they're exempt from risk. And also to remind everyone that the individuals here, for the most part, more than 80% of them did have some pre-existing comorbidity. So the risk in those with comorbidities is something that we want to try to mitigate. And one of those mitigation steps is, again, that vaccination that we want to encourage everyone to take up as it becomes available. Looking quickly at how we've been going, projections and performance-wise, that gray line, which may or may not be easily visible, on this graph is basically the projected number of cases that we expected to see had we continued along the path on which we were going between June 3rd and June 17th. So far, we've seen that more or less we have continued along that same path. The slowing hasn't continued to accelerate. So we've been basically holding pace, more or less. Haven't slowed any more quickly than we were doing before, but hadn't turned around either. So again, we're looking at potentially some plateauing, but we are continuing to observe the trend as data continues to come in. I'm going to turn you over to Dr. Richards for the health system update.
Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, National Security, Energy, and the Office of the Prime Minister. This afternoon, I would like to present an update. Of course, good afternoon to the medical team, members of the media, and members of the viewing and listening population of Trinidad and Tobago. This afternoon, I would like to present an update on the status of the hospitals in the parallel healthcare system. As of July 17, 2021, there are 16 institutions consisting of 9 hospitals and 7 step-down facilities with a total capacity of 1,022 beds. The information provided is as of 8 a.m. on July 17, 2021. As Dr. Hines indicated, the rolling average, which is the average number of positive cases over the last 7 days, continues to decrease. There's been a sort of plateauing, and this is a good sign because the rolling average allows us to estimate how many hospital beds and how many patients would require care over a 3 to 5 day period. The orange and green lines demonstrate admissions and discharges in the parallel healthcare system. And on or about from the 28th of June, you would notice that the gap between the admissions and discharges continues to be narrow. Again, this is a positive sign because it demonstrates that there are not much additional patients being added to the parallel healthcare system on a daily basis, and so there is the capacity to treat patients requiring care. If we look at a breakdown of the admissions and discharges, we would notice that the number of admissions over the last week remained on or above constant. However, the number of discharges decreased between week 27 and week 28. It is important to note that the admissions and discharge of patients is really dependent on how ill the patients are, and that is the clinical severity. So it would indicate that over the last week we had more ill patients as compared to the last week, resulting in them being kept in hospital for a longer period and being discharged later. This would really be evident when we look at the increase of 29 patients over the last week. And over the last week, the parallel healthcare system had 78 additional patients. This is an important graph because it shows the actual number of patients in the parallel healthcare system. And we would note that as of 8 a.m. this morning, there were 385 persons across the 16 facilities. 296 of these persons were in the 9 hospitals in the parallel healthcare system, with 89 across the 7 step-down facilities. Similar to last week and the trends that we have been noticing over the past month, we would notice that there are 3 times as many critically and severely ill patients as opposed to recovering patients, really emphasizing the severity of the COVID-19 virus. The occupancy, of course, refers to the capacity of the system to manage patients, and there's been a consistent decline, however very slow, since May 28th or so, and today the occupancy stands at 37%. If we divided the occupancy by country, the occupancy in Trinidad and Tobago is currently at 39%, and it reflects a similar trend with the overall occupancy, while in Tobago, the occupancy today is 26%. That means 3 4 out of 10 beds in Trinidad and Tobago are currently occupied, with 3 out of 10 beds in Tobago. We also look at how filled, or the occupancy levels, at the 7 hospitals in Trinidad and Tobago that treat the severely and critically ill patients. And you would notice that from week 27 to week 28, that is over the last 3 weeks, the only one hospital, which is the Augustus Long Hospital, has been consistently over the 75% or critical threshold. However, one would also notice that the actual percentages are slowly decreasing. That is the orange bar. It is important to note that in the step-down facilities, all 7 facilities continue to be under 75%. And that has been a trend, again, over the last 3 weeks. If we broke up according to level of care, we would notice that the ward occupancy, where the majority of patients receive care, is decreasing again from the May 28 period and is currently at 37% overall. However, the ICU percentages or occupancies as of today are 72%, and the high dependency unit is at 41%. It is important again here to note that the ICU intensive care and HDU care, where we care for the most severely ill patients, continues to be high. So we still have persons who are very ill in the parallel healthcare system. The parallel healthcare system was also developed to protect the traditional healthcare system. And from the beginning of July to present, we have noticed that the number of persons in the accidents and emergencies in the traditional healthcare system continues to be low. As of this morning, there were 2 patients across the ERHA sites. There were 4 across 2 NWRHA sites, 3 across 4 SWRHA sites, and 9 across 3 NCRHA sites. The ambulance service system continues to show a decline, again very slowly. As of within the last 24 hours, 25% of transports overall were due to COVID-19. The turnaround time continues to be somewhere around 130 minutes from the time the patient calls to the ambulance being ready for the next patient. So thank you very much, ladies and gentlemen. I would like to urge you to practice the 3 Ws and to please obtain your vaccine, because this is an additional layer of protection against being admitted into the parallel healthcare system and developing complications. I now hand you over to Dr. Trotman. Thank you very much.
Honorable Prime Minister, Ministers, Dr. Pasram, members of the health team, members of the health care givers and the public, thank you for your service. Listening, viewing public, members of the media. We are at pivotal times. We are at a position where we are all going to be presented with the choice to take a vaccine, the COVID-19 vaccine. I am imploring all that when that vaccine is presented to you, that you accept it. And if you have already accepted it, encourage someone else to do so. I want us to also remember that the requirement is for 2 vaccines. 2 weeks after your second dose of your vaccine, you are considered completely vaccinated, which means there is a period for those who accept the vaccine, and I pray that's 100% of Trinidad and Tobago, that there's a period between first vaccine and second vaccine. Don't think for one moment that you are completely protected and you can go about business as usual. We know that that one shot gives some protection, as low in some studies as 30%. So it is imperative that you continue to practice your 3 Ws and take your second vaccine and encourage someone that you know to take your second vaccine. We are getting there, but there's still a large proportion of us who still are not vaccinated. So therefore, at a higher risk to develop COVID-19 and to develop complications from COVID-19. Please, take your vaccine when it is offered. Encourage someone to take the vaccine. We want to keep our hospitalizations low. We want to keep our population well. Practice your 3 Ws properly. Wear your mask over your nose and your mouth. Wash your hands properly. And please, watch your distance. Thank you.
Thank you, Dr. Strothman, Parasram, and Richards. Dr. Hines, thank you all very much for your presentations. I would like at this stage to ask the Minister of Health to go straight into our vaccination program.
Yes.
And brief us on what's been going on and where we're heading in the coming days ahead.
Thank you very much, Honorable Prime Minister. To my Cabinet colleagues, Minister Young, Minister Hines, Dr. Parasram and his team, ladies and gentlemen of the media, members of the viewing and listening public, a good Saturday afternoon to one and all. Vaccinations continue apace. I just want to echo what every doctor has been saying. Take the vaccine. I will give you a brief breakdown as to where we are as at close of play last night. Total first doses administered to date, 247,256. That's roughly 250,000 people. These are 250,000 people in a country of 1.4 million who have shown their faith in the vaccination program. That's a good number, and I want to thank each and every individual in that 250,000. Distributed across the RHA system, Northwest, the figures are there, 35,918. North Central, 54,423. Eastern, significant because Eastern is one of the lowest density populations in Trinidad and Tobago, but look at their numbers, 32,496. That means people from Toco, Matlot, right down to Rio Claro and Sangre Grande, and all those places are really, really on board. Southwest, 47,624. Tobago, 10,848. State agencies, 10,480. And the other agencies, which fall under the rubric of the private sector, Supermarket Association, and construction and so on, 55,467. That gives you a grand total of 247,256. Total second dose to date, 157,053. So if we go to the graph, because the graph is a little bit interesting today. So just to recap, for those who are seeing this for the first time, our initial goal, goal 1, based on vaccines we had and continue to have at that time up to now, that goal will change, of course, was 188,900. That was our goal to achieve that target with 2 doses by July 31st, 2021. So that's the horizontal purple line, or what I call the West Indies color line. That's the horizontal line. The green line shows the total number of people vaccinated with 1 dose, 247,256, which roughly equates to about 18% of the population. So roughly 18% of the population have had their first dose. What is interesting with the green line, if you look at it, you will see a significant uptake in the past week, where the tip of the green line is now actually vertical. That is in large part due to the take-up in the food and beverage sector. which we started vaccinating between Thursday and Friday. And I really want to congratulate the food and beverage sector, the workers. I visited with them at the paddock yesterday. All ages, all classes, all races, all nationalities. They are coming out and being vaccinated, and congratulations to you. They came from the range of establishment, from the big chains down to the roti shop. And those persons who have come out in their thousands are to be congratulated. You are showing the way for the rest of us. So first doses continue apace. The other line we need to pay attention to, and this is the big line, what I call the aquamarine line, 157,053 persons, which is roughly 11% of the population, have had 2 doses. So our target is for that aquamarine line to touch the horizontal purple line by the end of July. That will represent 188,900 persons with their second shots. This weekend, a lot of second shots are being administered. Today, tomorrow, early next week. So hopefully when we report to you next week, you will see that aquamarine line almost touching the purple line, which means we are on target. In going forward, so that is where we are. In going forward, we are going to be doing 2 things: communications and reach and accessibility for vaccines in the upcoming weeks. Let's deal with communications, because we have to get people, give them the information, encourage them, guide them to take the vaccines. You would have noticed we started a new series of TV placements called Voices of Vaccinations, using religious leaders, scientists, and so on. The response to that has been absolutely overwhelming. They have changed lots of minds. So thanks to the religious leaders, thanks to the experts. You are going to see that supported from next week, Tuesday, with social people in the social sector also joining in now with press ads. So you will see a press ad campaign starting from next week, Tuesday. Again, having people who different communities look up to for guidance, talking to you, talking to their communities about the need to be vaccinated. So that's communications. Social media will be also included. Reach and accessibility. There are some persons who will actively seek out the vaccine because they so care about their health. In medicine, and I learned this very often, they are the people who engage in what the doctors tell me is health-seeking behavior. They will seek out the vaccine. And that is what you will get in your initial stages. Now we want to appeal to that segment of the population who are willing to take the vaccine, but who want a little more convenience. In other words, I am not willing to drive 10 miles, wait for 2 hours to get a vaccine. So we want to make it easy for you. In the next week, we will be rolling out 3 new mass vaccination sites. Napa should be on stream next week. This is a joint partnership with the Trinidad and Tobago Chamber of Commerce. Penal Power Gen Station has already gone up Thursday and Friday with trial runs. And the Couva Point Lisa Chamber already went up Thursday and Friday with trial runs. So these 2, Couva and Penal, that were trialed should hopefully be in full operation from Monday, doing an average of 1,000 to 1,005 per day, and Napa will start their trial on Monday. In addition to that, we will be ramping up reach and accessibility now to every nook and cranny, village, town in Trinidad and Tobago via the reach of 109 health centers. Because now we have enough vaccines to do that. So you don't have to drive to a mass vaccination site. Your health centers will be reaching out to you to come and get vaccinated, anybody over 18. So there is no more restriction as long as you are over 18 and not pregnant. or if your doctor advises you against the vaccine. So reach, accessibility, convenience, 109 health centers. In addition to that, you may recall that 2 weeks ago we said we have about 64 sentinel physicians in the country. These are private practitioners who are on our database and who help us with surveillance and administration of vaccines free of charge. We are going to be expanding that reach by about another 50 sentinel physicians in communities. In communities. They will be offering you the vaccine again free of charge. So that is access, reach, convenience. And I want to thank at this point in time Dr. Vishy Bihari of the Trinidad and Tobago Medical Association. They have really come true for this country. Thank you. In addition to ramping up our sentinel physicians, we have also taken the decision, now that we have 800,000 doses of vaccines, to make vaccines now available to private hospitals who have agreed to administer these vaccines to their staff, their patients, their clients, their database, their communities, free of charge. I want to emphasize that. They have agreed to do it free of charge. This is corporate social responsibility and nation building at its best, where private physicians and the private hospitals are working together with the Ministry of Health to deliver these vaccines absolutely free of charge. So the takeaway point is this. Between the 6 RHA mass vac sites, 109 health centers under the Ministry of Health, the 6 mass vac sites being run by the private sector, close to 100 or 110 sentinel physicians, and private hospitals, anybody who wants to be vaccinated should have reasonable access to a vaccine. Why is that important? It is important for this next slide. And I hope this next slide can be shown. Yes, this one. I just want to leave the country with 3 headlines. 3 headlines, international news reports. From Medscape, Damian McNamara, June 29th. Almost all U.S. COVID-19 deaths are now in the unvaccinated. That's a takeaway. You who have access to a vaccine now, we don't want you to be a statistic, a mortality statistic, an ICU statistic. Forbes Online, Maryland says 100% of June COVID deaths were among the unvaccinated, as early data shows similar trends nationally. And the last one, AP News, nearly all COVID deaths in the U.S. are now among the unvaccinated. The simple takeaway, ladies and gentlemen of Trinidad and Tobago, and anybody living in Trinidad and Tobago, whether you are Venezuelan or whatever, please take the opportunity when it is presented to you to take the vaccine. It will save your life. It may save your parents' life, your children's life. It will save your job. It will save businesses, and it will save TNT. Thank you very much, Honorable Prime Minister.
Thank you, Minister Dayal Singh. I think this is a good point for me to join the conversation and the communication with the national population on this whole question of who gets vaccinated and who does not. Ladies and gentlemen, citizens of Trinidad and Tobago, you may recall that when we started out responding to COVID-19 at the beginning of 2020, there were options available to the government, and many of those options were rooted in what new law we should bring out and what heavy hand the government should use and all of that. And in fact, there was one person, one legal luminary, who even argued that the public health ordinance under which we operate is too broad and we should enact new law and narrow the government's authority to respond to the virus. And of course, a lot of my parliamentary colleagues clamored for the parliament to run the response to the virus and so on. From this podium, I told the national population that the cabinet, and as Prime Minister, leader of the cabinet, our response would be based in an understanding of the nature of the problem, the nature of the required response, and that being very personal and relying on the responsibility of the individuals who are all at risk, every single one of us, that our response would be based on relying and trusting the good and common sense of the people of Trinidad and Tobago. And that has been the policy that we have followed. We have made regulations and we have amended legislation along the way to ensure that the government's position is legal, because we are constantly under legal threat. We spent a lot of time in the courthouse fending off legal challenges. I must say, so far, we have been successful by and large in virtually every single instance. So we are confident that that trust that we have placed in the population is not misplaced. And with respect to vaccination, it is in that context that the vaccination program in Trinidad and Tobago is voluntary. That should not surprise anybody, because we expect that everybody in Trinidad and Tobago wants to live, want to survive the virus, and therefore we leave it for your action to give you the best chance with that outcome, because the response to this virus is largely personal responsibility responding. I was in a program with Dr. Tiwari recently, a couple of days ago I think it was, and Dr. Tiwari asked me a question in the context of this matter of members of the business community determining how safe their workplace should be and who should be in the workplace to bring about that safety, and whether in fact we are going to be using mandatory responses in the vaccination program and make it legal and forceful that you be vaccinated whether you like it or not. I was very clear in my response when I told Dr. Tiwari that we are carrying out a voluntary program and that we have not considered a mandatory program, and that, however, if sometime ahead of us a new virus or a variant of this virus or any kind of infection assails this nation and is far more destructive than this one, or the condition is more destructive than this one, then this government, like every other government in the world, facing that condition, will have to act. And at other venues, I made it very clear that the matter of mandatory response has not been before the cabinet, and we are not there at this stage. We are managing the virus and its variants with what is in front of us at the moment. So that being said, and that being the government's position, I am very grateful for the conversation that has taken place about mandatory vaccination, because I see it as an educating conversation, and it has a number of sides. But the one side it does not have, thanks to my free legal advice from the legal luminaries at the end of the bar table. I am not a dictator, and I will not be dictating to anybody in this country on any matter. But however, if we do, God forbid, find ourselves in a situation with a virus or a bacteria or anything like that that is killing people like flies, and we have a medication that can be administered to people, I don't know that I'll be inventing any new positions in this country, because we have done that before. There are a number of vaccines that are applied to this population on a daily basis without any of the, how should I put it, any of the moon landings that we're discussing, or the Mars landings for that matter. So I don't know that we need to be anything other than responsible. And how do we respond? There are millions of people around the world who are now vaccinated. As a matter of fact, hundreds of millions. There are hundreds of millions of people around the world who are now vaccinated. And there are also hundreds of millions who are not vaccinated. The data from those two sets of populations are that, one, the ravaging of the COVID-19 virus and its variants is considerably reduced or ameliorated for those people who are vaccinated. So that means you don't have to be a scientist, that the vaccines are contributing to an improved response of the human population. In some populations, they are reporting no deaths and considerably reduced clinical conditions. If you get infected, it's a mild infection like the normal flu, and you get over that and so on. But on the other hand, the other side of the data is that we know that we are still in the pandemic. The virus is still killing people and infecting people, and in some instances, hospitals are still overflowing in some communities. Those communities are, in fact, being seen to be the ones where the unvaccinated population is suffering the ravages of the virus in a way that the vaccinated population is not being affected. So to come back to our policy, if that is so, if those are the facts, not made up by this government, these are the facts published in the international community by governments who are managing populations. I understand that 3.6 billion doses that are already administered and being monitored across the way. And if that is so, then I would expect that the reasonable response of the people of Trinidad and Tobago is to find ourselves in that population of vaccinated people for whom the ravages of the virus would be considerably reduced and work towards some form of elimination. That's what I expect. But of course, every person has his or her own story. There might be circumstances, I know at least one person who wants to be vaccinated desperately, but has a medical condition which is causing that person to be hesitant, and the healthcare providers to that person to, be a little concerned as to whether the person would react properly to the introduction of this foreign body into the person's body. So there are cases like that, and I don't know that anybody could argue with that. Because I could say, I am one of those persons. I was vaccinated on Monday, but I did so under the guidance of my healthcare providers, both at home and abroad, as to, given my condition, whether I should, in fact, be vaccinated and what is my best chance and what risk I'm exposed to. And I was guided and I took the vaccine when I was advised that it was safe so to do. And I'm sure I'm not the only person in this country who has that problem. So that category of person is I expect that you would be reasonable with them. On the other hand, there are people who are feeding on the conspiracy theories of social media. And I say this if only to mention to you that only this week, the United States Surgeon General has described misinformation in the United States as a public health emergency. Let me repeat that. The United States Surgeon General took a public policy position to tell the United States population that misinformation about COVID virus is a public health emergency, meaning that a lot of people are fed lies and ridiculous misinformation. They are believing it, and they are responding to the virus based on that misinformation. And I don't think that the people of Trinidad and Tobago are in any different position, because you know and I know whatever goes on in New York, it takes 10 seconds to land in Port of Spain. And we get the same body of misinformation. So for those people who are making the decision based on the misinformation that comes to you from sources other than the health department that you pay for. Because I want to draw to your attention, all of you, all these wonderful doctors and nurses and all these hundreds and thousands of caregivers in this country are on your payroll. You pay them. You pay them to be in a position to guide you. You pay them to be in a position to look after you. You pay them to be in a position to stand by you if you get sick. And if you want to ignore what they are telling you and pay attention to nameless, faceless foolishness on Facebook and wherever else, that is your choice. But when you make that choice, you are also affecting other people's choices. Other people have a choice too. So when you claim the right to make your choice, just also grant that right to other people to make their choice. I want to say to the population of Trinidad and Tobago that we have done reasonably well, and in some instances very well, in facing up to this virus. Today, we mourn the loss of approximately 1,000 people. At an earlier time, before we lost anyone, I cautioned this population not to wait until we start to count coffins before we seriously respond to this virus. 1,000 people being lost in a population of 1.4 million. 1,000 families or more, many, many more than 1,000 families, feeling the pain of that loss. And what we can comfort ourselves in is that it could easily be a whole lot worse, because there is no cure for COVID-19. The infection that can come our way is airborne, and some of the variants are turning out to be more infectious and more virulent. So history has shown in pandemics that as the virus survives and mutates to continue to perform and propagate itself, that it sometimes, more than often, the later variants are more dangerous than the original one, because the virus is fighting to survive. It's mutating to be able to survive our response. So we have to bear that in mind. And we have to bear in mind that if we are vaccinated, it is the only known, I don't want to say curative response, only known reducing response, where it reduces our exposure. It reduces our condition. There is no cure. Last week, Dr. Trotman told us about a drug that was approved to treat patients who were in late-stage clinical condition. So if there is no cure, if you get infected, and if the infection is happening easily, and the chances of you coming up against a more aggressive version in the weeks and months ahead, the Delta variant, I don't know when the first person will get through to bring it here for us, because we are in the world's population. But if that is the outlook for the future, then I want to say to the national population, the only reasonable response we have is to find our individual selves in that population of vaccinated people who around the world it is being shown to be responding better. And better means the vaccine allows you to not require hospitalization even if you get infected, and not to become a statistic as a person who died from COVID. I think that's a good deal. I think those benefits are a good deal. But I also know that there are other people who have other reasons. You know, I watch these programs from time to time, and there's a running commentary that, because comes from people who live on Facebook and make comments, real-time comments going on. And it is amazing how there is that population there of some people. And a lot of them are trolls, right? But there's a limited appreciation for seriousness there. Because even as the CMO is speaking, or Dr. Hines is speaking, or the Minister of National Security, the only comment they could make is lie. 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 So in other words, they're not prepared to believe anything that is being said for their benefit, for their education. And what does one say or do to such a person to get them to understand that it is not a lie? It is that you are insulating yourself from the fact because it's inconvenient for you for some reason. Those inconvenient facts, ladies and gentlemen, in those inconvenient facts may lie your future. And the life you save might be your own. But in this pandemic, you are not required only to look after your life, because the infection spreads from person to person. And while you might think that you're protecting your life to please yourself with the decision you make, there is a requirement and a responsibility to the other lives around you, and that's where the government comes in. So even though today, we are not having in front of us mandatory vaccination as a discussion or a policy at the level of the cabinet, outside the cabinet door, there's a future. There are viruses. And if the condition arises, God forbid, that a government, including our government, has to intervene to protect the lives of its citizens, I simply say that would be the responsibility of the government to determine when that happens and how it happens. So whether it's 3/5 in the parliament, the whole parliament, because the first set of people that might fall on is those in the parliament. But the population relies on good decision making. And I think we have been making good decisions. And today, the month of July, as we had been looking forward to, we are in the middle of July now. Our vaccination program is well underway. Minister has read out availability of vaccines, but for heaven's sake, as you are going to take advantage of these various sites that we are putting out there to increase the accessibility and availability, let us not recreate the all of us go there same time and create a problem that could be avoided. Let's have a steady stream, and avoid congregation. That's all we have to do. And let's use up the vaccines that we have. We have 400,000 that we are using now, and those who are receiving those will also have to receive another 400,000 again, and we would have vaccinated 400,000 people to add to this 200, that's 600. Encouraging that these centers be utilized, because the quicker we get the vaccines into people's bodies, the quicker this population will be among the world's population of vaccinated people. We've done some talking before. We've done some instructions before. And come this weekend into Monday, major openings will take place in our population. Major. But of course, we're going with boundless faith and confidence in what we are doing, because we're not operating vice-versa. When we said we were going to bring our children out to do their SAA exams, we were given all kinds of reasons why we shouldn't do it, because the moon was going to fall off of the sun and fall on us. That didn't happen. We planned, we cooperated, we consulted, we executed, and we have our children's exam in hand being marked now, and they're back home. That exam took place very well. We are aiming to be in a good position in September. So July and August, we expect to keep that vaccination program going. And as of now, we have enough vaccines in hand to keep us busy until at least the first week of August, into the second week of August. We expect, as I said before, to get additional supplies during that period. While we are using up these vaccines, we have 1 or 2 streams of vaccines coming in, and we hope. But you know, vaccine supplies seem to be attracting disruptions. I was telling you before that I was in communication with President Ramaphosa of South Africa, and he was so understanding of our situation that he committed to us that whatever happens out of in Pretoria and for the African Union supplies, we will get some of it. And of course, I was talking to President Uhuru Kenyatta and the President of Ghana. They're all on our side. But look at what's happening in South Africa today. Something happened in the court, and South Africa is in turmoil. And some of that turmoil could or might have affected what we have been planning, because our vaccines from Africa were coming from South Africa. That wasn't done. When we had those discussions and those agreements, that was not on the cards. But in the last few days, there have been some significant disruption in South Africa, and we hope that those things will die down, and where we get to a position where South Africa can play its role in vaccine production, because we have a stake in that. The other supply, which is the COVAX supply, we are still expecting a small order coming in from the COVAX in August, and there might be some more COVAX coming from the offerings of the developed world. And then I mentioned on that small program, with Dr. Botiwari when he raised it with me about the children. I can tell you now, based on the documents we have signed with the American offer, one of the documents we have signed involves an identification of the supplier. So in the event that we reach the point, and we hope that we do get there, that we get vaccines from the United States, those vaccines are more than likely to be Pfizer vaccines. And I want to say it here now, that is the only vaccine that has WHO clearance for the use on children from age 12, from 12 and above, which means our secondary school children population. If we get our hands on those vaccines, it will be the only vaccine that is available with a clearance for use on children. And if we get our hands on a supply from the United States, do that supply, and given the quantities that might come to us, would be the first call on those vaccines would be our high school age population. And that would put us in good stead to present them at school in September. So we are hoping that no other problem arises in the United States, which will affect where we are. We took a long time to get here, and I'm keeping all my fingers crossed that we would get some of those vaccines, because if we don't get it, the vaccines that we are getting from other sources are not vaccines which are this time authorized for use on children. So if our children go out to school, they will be going out unvaccinated, but we hope that we do get some Pfizer which will be utilized on children. And what that will do, it will broaden more of our population into the vaccinated zone, and the risk of young people getting infected, facing down the virus with their stronger bodies and taking it to the older population would be considerably reduced. So we are keeping our fingers crossed, and we are happy that the variety we could get from the United States, when it does turn up, is the one that we can use for the school-age population. So that is a bit of good news that we are waiting to see unfold in the weeks ahead. And that is going to be, from all reports in front of us, that is aiming to be an August operation. And let me just say it now for the adult population. If there are any of you out there waiting for the Pfizer, as long as you are not in the secondary school population, you will be waiting. Because what we are seeing and what we are likely to get would be utilized on the secondary school age population. And that we could do that very quickly once we get it. So you'll be kept apprised as to how that progresses in terms of the availability. As I said, we had to sign 3 documents, and we've finally done that. And we are now waiting the next step, which is I think the allocation has been made, and we are awaiting the logistical release. But that is not under our control. there is something, given what I said a while ago about the opening up that's taking place with respect to the border opening, which today, for the first time in a year and a half, or thereabouts, March last year to now, our airport was closed to traffic, to commercial traffic. Today we opened up. The first flight came in as a commercial scheduled traffic. So this is a huge step for us to take. And we're taking it knowing that we are still under threat, but we are also operating with significant cautions. And you were told before what the conditions for entry, are. Unfortunately, I could tell you that in the first shipment of people into the country, the very first one, we have an instance already of people not wanting to cooperate with the restrictions. I want to make it clear again that we are not giving any passes to people who believe that they're smarter than the rest of us, because there are some people who believe that all of us stupid, right? But that's okay. We have regulations, we have rules, and we're going to enforce them rigorously to protect the population of Trinidad and Tobago. Decisions made in Trinidad and Tobago for the protection of the people of Trinidad and Tobago are not open for second guessing by others. But I expect that it will go smoothly, and that includes the law enforcement as well. And we are expecting our food services to open tomorrow morning at 6? Monday. Tomorrow is Sunday, yeah. Monday morning. Let me repeat that. Not tomorrow morning. Let me correct myself here, please. Monday morning. Before chains get broken and go out there and be so disappointed in the morning when you meet the restaurants closed. I know how people are waiting for Monday morning, but again, I want to caution. Go enjoy your outdoor food or your best restaurant food and so on. But please, as you do so, do not congregate. You may be in a line. You may be in a group, but spread out. Stay 6 feet away from the person in front of you, and we will all be happy that you're getting your favorite meal, but you're doing so safely. And of course, ensure that the mask wearing, ensure that the clean hands, ensure that you keep that distance. That is an imperative. Because Dr. Hines showed us something there today. I want to draw it to your attention, if you missed it. When we got into trouble in April, from May and June, cast your mind back to the panic that hit this country on the day when there were 25 deaths, which climbed from the teens to 25. Some people were pressing the panic button then. Remember, we started at a lower threshold in March. February, we were down at our lowest in terms of infection. It climbed up very slowly into March, and then it started to climb. And that threshold that we came from in March very quickly gave us May and June. Now, if we are to not carry out our personal protections and our national protection, and we start turning the curve up now, we're starting from a much higher threshold. What that means is that the increase in the negatives will be considerably higher. Because if we came from 20-odd, 30-odd, where were we? Yeah. See that valley there in March? If we came from there so quickly, up to the top of that olive band, if we are to start on the purple, on the right-hand purple or high, there to go up, the outcome is going to be a lot different. So when you are demanding that we do more, we open up more, we do less in terms of protection, and in furtherance of your rights and your rights, remember that we don't want to count our outcome only in the column of deaths and overflowing hospitals. And that is why I pay most attention to Dr. Richards' presentation every time. because she tells the country our capacity for providing health care for those who need it. There were a few days in this country when we were at capacity. Fortunately, we responded, and the response was the outcome, we move away from 100%. Because I tell you, once the capacity of the hospitals are reached, we don't have to look underground to find out what happens there. We've seen what happened in other places. We've seen what is happening in places with more resources than we have. And we've seen people who thought they were out of the woods, having been heavily vaccinated, who are now putting back protection mandates in the form of mask wearing, closures, and so on, because they may have opened up too far and too wide. So the caution that we are following is not because we don't understand your requirement to be out there doing what you want to do, but it has to be in an environment of caution. And we have pushed our caution to opening up construction, opening up food service, and of course, we are taking some comfort in the level of vaccination that we are carrying on, because every vaccinated person is one person less to facilitate the movement of the virus in the population. So we are relying on the minister and his team and the private sector, who's doing a wonderful job. At this point, I want to thank all those volunteers and private sector people who have joined this program and are executing the vaccination of our people. And I would end by saying that I have confidence that most people in this country would want to get vaccinated because there's a good reason so to do. There is no overriding reason to ignore it, except that you want to be in the population of unvaccinated people where COVID still has control of those people. COVID has to take a backseat to the vaccinated people. Not 100%, because we have seen instances where the vaccine has not prevented us from getting COVID. It's not like polio, where you take the polio vaccine and you don't get polio. But the best that's available to us. I've heard it said from some people that the reason why they don't trust this vaccine is because it was developed too quickly. That is comparing apples and oranges. Is the logic of that in a pandemic where people were dying, 4 million people have already died, that we were supposed to wait 15 years practicing with the vaccine before we use it to satisfy the length of time it took to be developed? But in that time, right, millions of people would have died, and we knew that there was a vaccine that could change those circumstances. And I could tell you, if one looks at the history of the other vaccines that were developed outside of a pandemic, you will see that these vaccines with today's technology have been more carefully developed. When the first vaccines were developed, they were developed in a small community, small nation. Even as vaccines developed in the last century, this vaccine, the ones that we're taking now, they have been developed using basically the whole human population. Because the data from populations around the world, because of the current technology, allow the data to be analyzed quicker. And it is one of the accomplishments of the age for us in a pandemic to have been able to find, develop, and make available the vaccines that we are using now with the relative amount of care and authorization given. So I don't think we should fear the vaccines because they were quickly and successfully developed. Of course, we have to acknowledge that as we go along, we are still learning, but learning enough to know that there's a benefit. And that benefit is shown by the data that says the vaccinated populations are not dying off, not getting very sick, and the unvaccinated populations are in fact getting very sick when they got infected, and they have a chance of dying. I don't think one needs a university degree to understand that, and you choose where you want to be in there. And as I mentioned, the opening up of the food stations, just remember, the food that's opening up tomorrow on Monday is takeaway, no in-house dining, it's curbside delivery, and take your food and scatter. And of course, no consumption on site, and we have not yet opened up the service of food for alcoholic drinks. Let's hold that a little while. The time will come when we would very gladly do that and look back on this period of restriction as creating a demand and an appreciation that wasn't there during the period. And we're looking towards the end of the month. Given what we have done so far in the fairly wide opening up, because if you tally the numbers, there will be large numbers of people coming out. We would want to watch the response to see how well we are responding before we make any further adjustments of opening up. So we have looked at the e-commerce and e-trading for those companies that have the ability to sell their produce electronically and deliver without the user coming to your store or your shop. We are still looking at that because we are not yet ready to open it up across the board to everyone. And in this country, if we just give it to those who are ready today, we face the discrimination argument. But we are looking to see where we can facilitate that kind of business in the very near future. And once it is in the context of the level of opening up that we would want to risk at this time, we would consider it. And of course, general retail and personal services, we have to look at what this phase of opening means. Look at it till the end of the month, because I can tell you, we looked at what happened 14 days ago, 2 weeks ago, what we did then, and we saw the effect of it at this time, and that cautions us to watch what we're doing now and be careful not at the end of the month to be in a situation where the story is not who didn't come out and who didn't come out, but who is heavily infected and how many people are dying. That's what we want to get away from completely. Because we are living with the virus. There's no way out. Even as vaccinated people, we are living with the virus, and the virus still has some ability in and amongst us. And that's why we want to vaccinate as quickly as we can and reduce as much as we can those numbers of people who are unvaccinated. So today there's an appeal to the unvaccinated. Don't get tied up in the legal arguments and the other kinds of things. Get high on the idea of being among the vaccinated who have the better chance or the best chance of facing down this virus. We did last week talk about the exercising outdoors, groups of 5. We'll hold on to that, and that means those people who are going on the golf course in groups of 4, you are in there, but no congregation and no service. Just use the course as an outdoor area for a group. And of course, no team sport, no contact sport, except we did get an exemption exists for national teams. That still stands, but at the personal level with your clubs and so on, not yet. Not yet. We are doing well. Let's continue to get the benefits of doing well. And I'm confident that by the middle of August, we could be telling you a bit more, because then we're going to be laser focused on what's going to happen in September. And September, our big target is hoping to be able to have vaccinated the population enough to allow the children to come out of school, or better still, to have vaccinated some of those children if we get the appropriate vaccine. So thank you very much, and if you have any questions to the health team, the minister and myself will take them now.
Minister, I was saying you said at health centers that they will be reaching out to people. So how is that going to work? An appointment system? Are they going to be? How is that?
Yes, thank you very much for the question. Yes. So they have already reached out to communities and asking people to come in and register. So that's at the individual level. Some miking has been done. They have put flyers in people's mailboxes. They have reached out to churches, mosques, mandirs, NGOs, and so on. So that is a medium that they are using and asking people for their names, phone numbers, and they will be registered, pre-registered, given appointments, and you come in and be vaccinated. What we don't want is what happened the last time, where you have the elderly out in the sun and rain, and so we don't want that. We don't want that type of congregation. And that has already started. It started on Thursday, Friday at some health centers, but we are ramping it up now. So the health centers will be contacting you. The health centers will also be reaching out to their own clients that each health center has on their database, their different clinics and so on, whether it's an NCD clinic, an asthma clinic, whatever, foot clinic, whatever. Okay? So that is how it's going to work at the health center level, 109 across Trinidad and Tobago.
Okay. Well, also from Minister Hines or someone, have we seen any increase in COVID activity when it comes to fully vaccinated people as well? Doctor, sorry.
Okay, so I'm not quite sure I understand the question you're asking. If we saw an increase in COVID activity when it comes to...
So that you'll monitored about 300 people, and none of the unvaccinated were with death. We had one death with fully vaccinated. Well, not fully,
No,
but
so what
one.
we said, and I'll reiterate because somehow the message got garbled between the podium and the paper. What we said is that at that point, there had been 341 total deaths. At this point, we're up to 393 between when we started monitoring and now. Now, this is deaths in all versions of individuals. And among those, between June 8th and present, none of the deaths occurred in fully vaccinated individuals. There was a question about individuals who may have received 2 jabs, and what we pointed out is that in the instance where that may have occurred, the individuals actually got infected prior to the second jab, and therefore were still not fully vaccinated. We also took the time to emphasize that even after your second jab, you're not considered to be fully vaccinated until a 2-week period has elapsed, so that the deaths that occurred between June 8th and now have all occurred in either completely unvaccinated individuals, or there's a small group that has had 1 vaccine on board. So that's the clarification. I hope that gets carried clearly this time.
As well?
Harder to tell. We're actually still compiling that. The death information is always a little easier to collect because of the whole mandatory reporting. But we are looking at getting that information and analyzing it, so we'll be able to answer that at a subsequent point. Any other questions for me before I leave the podium?
Good afternoon, everyone. Kimberly D'Souza, TTT News. Prime Minister, you mentioned one incident that happened at the airport this morning. Do you mind sharing some more details on that and just give us an overview of how everything went this morning, with the borders reopening?
There isn't much more to say than I have said on it. It might become a legal matter for some individuals, so I wouldn't want to dwell on it. But I would like to ask Minister Young, who started out this process in his capacity as Minister of National Security, and he's still Minister in the Office of the Prime Minister. could you bring us up to date as how the opening went and what it means in terms of rules and regulations?
Thank you very much, Prime Minister. Good afternoon, Cabinet colleagues, CMO and his team, members of the media, wider viewing and listening public of Trinidad and Tobago. As the Prime Minister just pointed out, a few weeks ago, the Prime Minister announced the reopening of the border. Today, we've arrived at that day. In the middle of it, we had asked that the Office of the Prime Minister just chair the committee with all of the relevant ministries, my colleague from National Security, colleague from Ministry of Health, Minister of Digitization, and the Minister of Works and Transport, who was up at the airport this morning. So we've arrived at that day. We know a commercial flight came in this morning from Guyana. We got the system up and running. This is the TT Travel Pass system, platform system for persons who are coming to Trinidad and Tobago. You have to apply, get a certification before entering Trinidad and Tobago. That was launched on Wednesday, as you are aware. It went live on Wednesday afternoon. Whilst we were in that launch, you had people trying to test the system. So far, the system has shown that it's a very robust system. We have had hundreds of people applying. One of the most important things to understand about the system and the certification is you can only get that certification 72 hours before entering Trinidad and Tobago. So you have to upload whether you're vaccinated or you're unvaccinated. You have to upload that negative PCR test. There seems to have been some minimal confusion. We've had persons reaching out saying that they didn't realize that children were supposed to have negative PCR tests. That has always been, since we introduced the requirement of a negative PCR test 72 hours before entering Trinidad, it has always been in place. Prime Minister, I'm happy to report that the system is working. We've been tweaking as we go along. For example, there were certain things that right now Caribbean Airlines is the only commercial airline flying into Trinidad and Tobago. As soon as the others are ready, they haven't put up their scheduled flights, they will be worked into the system. So like overnight, we had to add other for persons who are still coming in via charter flights. So these are some of the tweaking arrangements that are going on. This morning, we had to deal with certain persons who have gone away and gotten their children vaccinated using Pfizer. So, of course, no children who are returning to Trinidad and Tobago are required to be quarantined. If you're an unvaccinated national, you're required to go into quarantine. So, again, the system didn't have that information for children who may have been vaccinated. So it's being tweaked as it go along. We haven't had any major problems. I keep getting the reports from Minister Bacchus and his team that it is working well, and everything went smoothly this morning. We have a flight coming in tonight, Prime Minister, a CAL flight from Dominica, and then tomorrow is really a big one coming in from Miami, and that continues to go well, and so far, and we will tweak the system. For example, one of the things that came up is we have to add the legal seaports of entry. So it seemed like every yachty was waiting at the start line and wanted to set across the border this morning. So we're working those things in because, as you know, there are different seaports of entry. They still have to have their negative PCR test. Any unvaccinated non-national at this stage is not permitted in Trinidad and Tobago. So we need to be regulating that. But so far, by all accounts, all of the systems are working well on the IT platform and the entry into Trinidad and Tobago.
Prime Minister can answer. We had a flight coming in, but we also had a repatriation flight with Venezuelan, a repatriation marine transport with Venezuelans this morning. Do you care to comment on that? Did you have anything to say on that?
That was handled by the Ministry of Foreign Affairs and the Ministry of National Security. As I am aware, I think everything went smoothly. I believe the Minister of National Security went down there. But again, as of today, there really is no further requirement for us from the exemption of the border side, but that was it was managed out of those two ministries.
Question from some of our leaders.
Let me just clarify that, because that was an arrangement handled by the Venezuelan embassy and the government and people of Venezuela. It was purely a matter of Venezuelans who are here, and I expect that they would have been registered, and whoever they are, they were in Trinidad and Tobago and they wanted to go back home. Between the embassy here and the government, they organized transportation, and so that was not a government of Trinidad and Tobago organized matter.
from Guardian Media. Prime Minister, have all members of cabinet been vaccinated, or at least partially vaccinated?
I don't know. I do not monitor members of cabinet, but I would be on for that. But given what we have been asking the population to do, I would be very surprised if there is any member in the cabinet who is asking the population to do otherwise. But I have not polled the members of cabinet.
Minister Dial Singh, a couple of weeks ago, I think it was about 2 press conferences ago, you said around 50% of all nurses have been vaccinated. Has there been any, correct me if I'm wrong, has there been any improvement on that front? And if not, is that a cause of concern for you and your ministry?
So, good thing I have the notes. This was the press conference on the 3rd of June. At that time I said 8,861 healthcare workers were vaccinated, right? And the total complement of healthcare workers in the country is roughly 16,600. So 50% of healthcare workers on the 3rd of June were vaccinated. And at this point in time, let me again express total gratitude to healthcare workers, doctors, nurses, everyone. Yeah. So since then, I have been working closely with President of the TTRNA, President Edie Stewart. He and I have been working very closely to bring out more and more nurses. Not only nurses, we have expanded it as an encouragement to their families, their spouses, children over 18, and we are working very closely, and they have been coming out more and more, for which I am grateful. I'm grateful for their service. I am now grateful for their leadership. But I don't have the actual figure. I should have some more figures next week. But the nursing complement, we really want to get that up. At that time, I did indicate I wanted about another 4,000 to be vaccinated to take up the healthcare worker cohort from 8,861 to around 13,000 out of a total workforce of about 16,000. So it's a work in progress, and President Stewart and I are working together on that.
Minister, sorry, are there any groups that might require like a third vaccination shot? The reason I ask is because there was someone who reached out to me who had kidney issues, and he was saying something about hearing he might have to get a third vaccination shot, so he was trying to get some information.
So the issue on third booster shots is one that the CMO and I are looking at closely. And CMO, if you will come out and tell the country what is the latest evidence, and we only go on evidence, what is the latest evidence on whether you need a third booster or not? But very good question.
Yeah, so for that particular category of patients, the renal dialysis patients, persons with chronic kidney disease, there is a body of data that suggests they may need a third shot. I think the research is being done with Pfizer, that particular vaccine. Some data has come to me from the specialists in that particular field as well. And the Pfizer vaccine has also applied to the WHO to consider having a third shot, not only for that group, but for everyone, for Pfizer. So we await WHO's determination, and then we will follow on those determinations.
I don't want any book for this question. It's a colleague passed along this question to me.
Maybe go book to colleague.
Let's get very parliamentary, right? Any question you ask is your question, right?
You take ownership.
What was the question? Go ahead and ask it. What is this? According to my colleague, he said the death rate in the country, COVID death rate, I think he said seems to be a little higher than the global death rate according to his research. And what he's asking is there any possibility that that someone who dies from natural causes and who tested positive for COVID could end up falling under the category of COVID-19 death?
So I mean, generally speaking, before Dr. Hines comes in to give you the exact figure, I had said at an earlier press conference, it depends on which category of people become infected, you find your death rate will change accordingly. Our death rate has gone from anywhere between 1.7 all the way up to close to 3 at one point. So Dr. Hines will give you what it stands at now. If you have a population of people being infected who are a higher age group, for example, people over 80, if you get infected in that group, your death rate in that particular that group is about 20%, so 1 in 5. So it depends on who is being infected And again, we started our vaccination program, who is being vaccinated. And it's a number of factors that go towards the global death rate in any one country or in the world. When you do it in the world, you tend to get, because it's such large numbers, you tend to get an averaging out of different countries. Some countries are less than 1. Some countries are over 14 or 15 in terms of a case fatality rate. So you have to take it in context. So Dr. Hines could give you the exact figures for Trinidad.
Okay, thank you. CMO didn't leave me with a lot to say. But just to explain something that, again, somehow got garbled between podium and paper when we spoke at the press conference last week, Wednesday. Now, we pointed out that we were seeing increased numbers of people in an older age group becoming ill. And that in many cases, those, especially at the extremes of age, the above 80, the above 75, were some of the cases that arose out of infections in care homes. We did not say that care homes were driving the epidemic. I do not know where that particular narrative came from, but please send it back. What we said was that we did notice an increased age range, an increase in numbers of people above a particular age becoming ill, and that several of those did actually arise out of clusters in care homes. Now, I'm going back to that because, as CMO just mentioned, depending on which groups of individuals get infected, your overall or average case fatality rate will be affected. So our case fatality rate went from around 2 just before May all the way up to 2.7 something at last check. Now, 2.7 something, while it's above the global average, still, again, corresponds to places like Italy, which was 2.99 the last time I checked, which had a similar profile of older individuals becoming infected and then having a higher case fatality outcome just because of the risk of death in those age groups. So, clarifying, we noted we're seeing more of the older age groups in recent times having been infected. That comes with its own impact on case fatality rate, given the fact that, as CMO just pointed out, in the over 80 age group, case fatality rate is actually 1 in 5, that's 20%. Overall, our current case fatality stands at 2.7 something, going towards 2.8. That does lie a little above the global average, but not outside the expectation in general, and not outside the range that has been experienced by other countries that have had similar profiles in terms of the age groups affected. I'm hoping that clarifies.
Some people getting COVID. No, you can speak. I don't know if you answer this question. Someone has actually gotten this because they personally have had their first shot, they got COVID, and now they're saying AstraZeneca is not available for them anymore. They want to know how, that's what they've been told, and they want to know if they have to start over and get a first shot again, or they just need the second shot. What is the process?
Okay, so thank you very much. Let me just deal with the issue. AstraZeneca is available for persons with second shots. Okay, we have ring-fenced both AstraZeneca and Sinopharm for second shots. Okay, thank you very much.
So what is the process then if you get COVID in between the shots?
Yeah, so generally speaking, just to clarify, if you have your first dose, as in that case, you have an infection with COVID-19, you wait 3 months from the date of that COVID confirmation that you're positive, and you have your second dose, which will be a booster. There's no need to restart the process. You just have your second dose, all right? And the same thing holds for Sinopharm as well.
And if you don't believe it,
No, 3 months
I can
after.
tell you for myself. I have had my vaccination, first dose. I am now in that period between the first and second. So if I get infected now, I have to wait for 3 months before I get my second. If I don't get infected, I get my first week of August. Within 3 weeks from the first shot, and I get it. So that's how it goes. Doesn't matter who it is. That's the protocol.
Come to represent, when you're out of COVID questions, I have one or two. Came to represent Jensen for you.
I think we're out of COVID now. I mean,
Prime Minister,
this is your question.
yeah, this one I'm clear. Prime Minister, given the economic impact of the pandemic, is the current public sector wage bill sustainable? I know other countries have been having problems managing this.
That's a big one. Even before COVID, the question of the public sector wage bill and its sustainability has been a matter of conversation. COVID has made that an even more pressing problem, because you know that since 2014, as a country, we have been suffering significant reduction on the revenue side. Public sector wage bill is on the expenditure side. And even before COVID, we were suppressing that expenditure to bring it down nearer to the revenue and closing the gap by borrowing. Up comes COVID, and it doesn't matter what we were doing, we were required to spend more to save lives and to keep people afloat in the country. So the public sector wage bill is in there somewhere. As we are handling it now and restarting the economy, to use a phrase, right? We will have to look at the revenue. But we always keep an eye on preserving livelihood, because in this country, the public sector wage bill and livelihood go hand in hand. The government is the largest employer of labor in this country. The government provides a huge panoply of services, and that's where that wage bill comes in. So while we don't want to be extravagant, we also have to keep our eye on preserving for those people their livelihood by being a government employee, but at the same time, how are these bills to be paid? We have done considerable borrowing to keep certain expenditure. We have to pay the public debt, pandemic or no pandemic. We have to provide the services that everybody say are essential and add new services to it. And that is why we are being so concerned to make sure that those who need the help get it, and those who are in fact trying to exploit the situation feel the full brunt of the law. And that is why yesterday you would have seen in your newspapers and others that the Ministry of Social Development is the subject of serious examination now. We await the outcome of that.
That was actually one of the questions. The Ministry of Social Development, what is your response to that emergent situation? And even one of your ministers had to come out and send out a message saying, it wasn't me, I wasn't in part of that investigation. Yes, Mr. Cummings.
What's the question?
What is your response to the emerging report of the investigation?
The one that I mentioned?
Sorry?
The one that I have mentioned?
Yes.
The one that I have mentioned in social development? Well, it's not surprising, but it's worrisome. And we still don't have the full picture, so it's an investigation. And it's going to go on and try and find out. The one thing that we're trying to prevent is a misdirection of the effort which that ministry is created to carry out. So if there's anything wrong there, we need to know, and we need to fix it.
Minister. Minister, there was an article in the Guardian media today that claimed that the Atlantic LNG's Train 1 plant will likely be mothballed in the coming weeks. Is there any truth to that?
Joshua, I'm sure that you and your colleagues collectively have by now seen the very careful statement that has been made out of the Ministry of Energy and Energy Industries, and that's the statement at this stage. The energy sector is a very sensitive one. We're in a global environment, and at this stage, as that statement said, we continue to be in very serious discussions with all of the shareholders of Atlantic LNG, and at the appropriate time announcements will be made. And exactly as the statement said, we've been playing our cards and moving the chess pieces very, very carefully, and now is not the time to disrupt that.
Prime Minister, just one last thing. This past week we lost our icon in brother resistance. Do you have any comments on his passing?
Well, as everybody else has acknowledged, we've lost another valuable citizen, an icon in the culture area, somebody who was driven, very enthusiastic, and he's made quite a contribution. And we acknowledge his passing, but we also acknowledge the tremendous contribution that he has made. And we extend our condolences to the family and all those who were associated with him in the calypso and other genre of music. So Brother Resistance was very well known. He was he came to the fore from UWI, a lot of students there, and a lot of persons who got into the calypso and rapso business and just the general culture of Trinidad and Tobago. These icons come from time to time. In recent times, we've lost quite a few, and so we have to cherish the ones we have. Thank you.
We've had 3 separate incidences. As head of the National Security Council, we've had the issue in April with a large amount of weapons being found, explosive weapons at the prisons, and we had 8 deaths this week. Have you had any response to those things? Are you concerned about any particular activity? Any reports? Have you gotten any reports?
As head of the National Security Council, you're always concerned. There's no day when you're not concerned about these matters. These are very serious matters. And the National Security Council has been functioning. Our security services are fully engaged. And we just have to be cognizant of the fact that in our population, there are citizens for whom the position is that crime pays, and they've chosen crime as a way of life. There are people who are prepared to supply us with items that we don't make in this country, like weapons, and people prepared to receive it. So we are cognizant of all of that, and therefore we are concerned and we are responding. And I am very grateful that our security services are responding, and we have improved our ability to respond. What's the question?
The question is the hours of business. Will bars be open allowed to sell alcohol? Will restaurants and bars be allowed to sell food?
Signed by whom?
Jensen.
Who?
Jensen.
He's not in the press conference. Thank you all very much for coming, and we continue to rely on you to accurately inform the public on a consistent basis. Thank you all very much. Thank you.
The music continues to caress us all as a people in this region, as we make our name in the world, as we